Hello, welcome to Noel PTV. Sa live stream natin ngayong gabi, we have several interesting questions from our first year physical therapy students of Norma Colleges, si Lois, Rhaycy, si Cyd and si Odella or Odelia. Okay, let me just check my audio if it's working. Hello, mic test. Okay, so it's working. So, I just found out na maganda pag sandali, send lang natin yung link. So, yun, nawala yata yung link ko. So, ngayong gabi, we will be answering questions from our first year physical therapy students from Lorma Colleges in San Fernando City, La Union. So, yung subject nila yung Physical Therapy 1, which is dating PT 101, Physical Therapy 101, an introduction to physical therapy, patient care, etc. Ayan. So, magandang topic ito, magandang subject for discussions about physical therapy. Okay, but before we push into that, gusto ko lang i-acknowledge yung feedback natin from our latest client na nagkaroon ng physical therapy services from our clinic in San Fernando City, La Union. So you can check out our Facebook page, which is facebook.com/noel.oribio. Okay, let me just check my settings. Yan, medyo mas maliwanag ng konti. Okay, so physical therapy ay facebook.com/noel.oribio. So let me just share with you our feedback from our Hello po, welcome to Noel PTV. Magkaroon tayo ng discussions ngayon. Ito ay, may mga questions po na pinadala yung mga students natin from colleges. So before we do that, I would invite you to check out our Facebook page. So i-type po ng ating team member. So facebook.com/noeloribio.physio. Yan. So if you can check that out. Okay, sa live chat natin makikita nyo yung isang, or I guess not. Hindi siya naka-moderator. Mag-login lang po ako sa laptop kasi naka-login ako ngayon sa iPad. Okay. So, bisitahin po ninyo yung Facebook page ng clinic natin. Ilagay ko yung link. So, ilagay natin yung link ng page for our reviews. Yan. Hindi ko pa rin makita if it shows up on screen. Ayun. So, facebook.com page Noel Oribio. So, mayroon tayong several reviews dito. Yung 4 days ago, so we had a client. So, makikita nyo naman yung profile niya, si Ma'am Heidi Apiado. Si Ma'am Heidi Apiado, sabi niya, the benefits really outweigh the cost. I suffered from neck pain and back pain due to muscle spasm for years until I undergone 8 sessions of therapy with Integrative Physical Therapy and Wellness Center. So fortunately, with their expertise alongside with prayers, back and neck pain had totally vanished. Back, leg, neck, and core muscles became stronger, and I turned out to be more physically active than the previous years. So yun yung ating focus with our treatments, with our healthcare services. So the goal of the patient, especially functional goals yung masusunod. Kasi she came in with problems of the neck and the spine and weakness of the lower extremities. So pag naglakad siya konti, madali siyang mapagod. So with our physical therapy sessions, 8 sessions of physical therapy, sabi niya the back pain and neck pain had totally vanished. Back, leg, neck, and core muscles became stronger. And she turned out to be more physically active than the previous years. Ayan. So thank you very much, Ma'am Heidi Apiado, for this wonderful feedback. Marami pa tayong ibang mga feedback din that you can check out on our page. Yan. Okay, so let's move on with our interview questions from Lois, Rhaycy, Cyd and Odella or Odella. Parang medyo marami yata. Pero sabi ni Ma'am Christy, pwede daw pumili ng ilan na tapos sasagutin. Pero we have 1 hour for live stream tonight, and I hope na masagot din natin substantially yung mga questions nila. Okay, so in no specific order, so sabi ng unang question niya, based on your experiences, what is the work of a physical therapist? Wow. So last live stream natin, sinagot natin, we answered the question about the work of a physical therapist being focused on achieving functional goals, working with the clients and achieving their functional goals. The problem with most of our understanding with physical therapy is that we've just focused on physical activity or functioning. But with present applications of physical therapy, when you work with individuals, individual clients, you focus on the totality or the whole person. So hindi mo maseseparate yung physical function niya from the emotional state niya, from the total wellness ng tao. So even spirituality, and sometimes they even share with you their faith and stuff like that. So from psychological health to emotional health to physical health, that is still part of the work of a physical therapist. Because remember, our work is related to human function. So hindi mo maseseparate yung emotional, psychological aspects of physical function. So in short, the work of a physical therapist is to really help somebody to get back on their feet and become functional and productive. So example, if a person had experienced a disease, an illness, or an accident, or even surgery, so naoperahan siya, and the movement ay affected, so the person's movement is affected, basically you need a physical therapist to intervene and work with the person to help him or her set functional goals and achieve them, and achieve yung normal or near normal function before what happened. Like if he had an accident and he can no longer walk, or he can no longer go back to work, or kung yung kamay niya yung affected and he does a lot of desk job or paperwork. So you need to help them overcome. So even physical therapists have units in psychiatry and psychology, because we need to understand the process of disability and recovery. So from early denial to anger to bargaining, until they get acceptance of their situation, and then they do something to overcome that condition. So yun, medyo as you go along with work as a professional physical therapist, you understand that you really work with the whole person. So hindi lang yung okay, sige, pasok ka, I'll do initial evaluation. So may hindi maganda yung lakad mo kasi may back pain ka or may tabing na buto sa likod mo. So let's adjust that. Let's do strengthening on your low back and you're good to go. So ganun yung basic na understanding sa work ng physical therapist. But in the process of working with individuals, you become, I would not use the word attached because that is unprofessional. So being a professional physical therapist, you work with a client on a level na you're working on a functional goal. Pero you need to learn about their circumstances. Sa mga Pilipino, magaling magkwento, no? So malalaman mo na yung kwento ng buhay nila. So from their immediate family hanggang sa extended family, sa mga neighbors nila, even situations nila. So when do you stop relating with your clients and with your patients and stay professional? So yun yung challenge again with the work of a physical therapist. Pero if you receive a feedback like the one na binasa ko kay Ma'am Heidi Apiado, na she said that after a long time na she felt so depressed and she felt hopeless kasi hindi siya makagalaw ng tama, konting lakad lang napapagod siya with a few activities. Her neck pain and spine pain, parang small activity would trigger pain on her neck and her spine. And after 8 sessions of physical therapy at our clinic in San Fernando, so, and prayers, and yun, syempre, there are various elements of our whole system. No? But again, physical therapists would work on all the various levels of the person. Yun. So yun yung pinaka magandang achievement natin when you change somebody's situation from hopelessness to hopefulness. So they target their functional goals, then your job as a physical therapist is a very rewarding job indeed. Okay, so I hope na sagot natin yung una. So second question is, what are the common practices of a physical therapist? Siguro practice settings ito. So practice settings. Okay, before I answer that, let's jump to the next question kasi mas personal siya. Can you describe your work environment? So in a way, ma-relate ko siya sa second question. I have 3 work environments, actually 4 or 5, depende how you count that. Pero my main work environment is the main clinic at the San Fernando City location. So in San Fernando City, La Union, I have a stand-alone clinic. So it's outside the hospital environment. Nasa community siya. It's along the National Highway. Very near, no? Across the street from the Robinson Mall construction site. So it's a 3-bed clinic. So outpatient siya. So we can fit 3 beds. So at the same, in 1 hour, you can treat 3 patients. The problem is I treat all my patients for now. So dati I have 2 clinic partners who are physical therapists, sina Ilona and Switzel, pero with the pandemic. So we did some changes, no? So they focus now on mostly on home treatments. So I do the clinic treatment. So sila, they do their private home treatments as well. So ako naman, I do mostly clinic treatments Tuesday, Thursday, and Sunday. So how is my work environment? So when a client comes in, so the law would dictate that you should have a referral. So may dala-dala sila na love letter, I call it a love letter, or a prescription from a medical doctor, physician, probably a neurologist or an orthopedic doctor, or a rehab doctor, physiatrist, or a pulmonologist, basta medical doctor, no? So they have their prescription and said for physical therapy. So okay na yun. I received one last week with a post-surgical condition, so naoperahan siya. Pero that was still in March, so with the pandemic na hindi natuloy yung physical therapy ng pasyente, so tinuloy niya ngayon. So yung condition is no longer an acute condition, so naging ano na siya, towards chronic condition na matagal na. So when we receive that, we do initial evaluation, tingnan namin kung ano yung current status ng functioning ng pasyente, and then we plan with the patient ano ba yung talagang gusto niyang mangyari. So syempre mostly highest or optimal functional level, nakakalakad, nakakagalaw ng walang sakit, back to work. Yun yung kadalasan na goal. Okay. And then we schedule it either 2 times a week or may pasyente ako 3 times a week din, pero mostly once a week session. So either Tuesday, Thursday, or Sunday. So 1 hour session. So yung work environment ko, I have beds, low bed and adjustable bed. I have several therapeutic exercise equipment. Therapeutic ultrasound, meron din pero we seldom use it now. We use manual techniques, very effective yung manual and manipulation, no, manipulative techniques. Therapeutic exercises, number 1 din. Functional training. Yun. I also have a clinic partner na occupational therapist, si Sir Lawrence Carriaso. So he comes by appointment din sa pedia, mostly sa mga bata yung pasyente niya, neurodevelopmental training. So very minimal yung staff namin, na nagjo-duty sa clinic namin because we are not in a hospital environment. Yung next na work environment ko ay sa community-based rehabilitation program sa Nagilian, La Union. So that is on Mondays, Wednesdays, and Fridays. Salitan kami ni Sir Lawrence. I usually take Monday and Friday. So siya naman Wednesday and Friday. So Friday nakikita kami usually doon. So may pasyente siya for occupational therapy and I do my patients for physical therapy. So the work environment in Nagilian is still very independent. So wala kaming supervisors per se. So nobody is looking after us. So we do our progress reports, we do our monthly accomplishment reports, and we give them to we are under the Municipal Social Welfare Development and Development Office. Yun. So kami doon, job order kami doon. So that's my second work environment. My third work environment is the satellite clinic in Urdaneta. So mostly Saturdays doon, pero if kaya Wednesday din, so Wednesdays and Saturdays. So pretty much like the main clinic, it's a standalone clinic outside the hospital environment. And then yung fourth work environment ko is home treatments. So I currently have home treatment in Cabah. So after several sessions then nakakalakad na siya. She's a stroke survivor. Meron din dati sa Rubio, Pangasinan, tapos sa Mangaldan, and sa medyo malalayo. Kasi on the way to the satellite clinic in Urdaneta, pwede akong dumaan sa isa o dalawa na home treatments. Ayun. So balik tayo sa question number 2. What are the common practices of a physical therapist? So I can only... Hello po, MP Bobby Ray. Thank you po. May questions lang po tayo ngayon from physical therapy students that we are answering. Ayan. So welcome po sa live natin. So yung common na practices ng physical therapist sa Pilipinas, number 1, ang pinakaunang job ko is teaching. Batchmate ko si Ma'am Christy SP Havaro, batch 1999 kami. So when I graduated and passed the board exam, so luckily I was absorbed as a faculty sa Lorma Colleges. So nagturo ako doon 1999 to 2002, I think. Yun. And then because I went to full-time mission and then I came back in 2004 until 2005. So number 1, faculty. As a faculty, magtuturo ka either as a classroom or full-time instructor or as a clinical instructor. So yung mga pumupunta sa clinics din with to check on the interns. So clinical instructor or clinical internship coordinator, tawag naman doon. Next one is as a full-time physical therapy staff sa mga hospitals, pwedeng sa tertiary hospital like Lorma Medical Center or in government hospitals like Ilocos Training and Regional Medical Center or sa mga specialized centers like at the uh, Heart Center in Manila. Yan. So, or sa mga foundations like Tahanan ng Walang Hagdanan and Stimulation and Therapeutic Activity Center, specifically focused on PEDIA, mga bata, rehabilitation for special children. Others would go into research. They would push for their master's and doctoral degree, and then they would do research on physical therapy treatments. So, magiging sila author ng mga libro. Pwede din yun. Okay. Others would do sports rehabilitation sa settings. So, halimbawa, basketball team, a national team, tapos kukunin ka nila as a physical therapist. But you also do the training with them. So, basically, if they run, you run. If they get injured, ikaw yung magpo-first aid, ikaw din yung mag-conditioning. I also have a friend who is into the fitness industry, si Ma'am Jo Montano. So, siya yung kasama ko na nag-training sa Singapore for the Special Olympics. So, isang din yan. Pero as a volunteer naman kami, coaches for the Motor Activity Training Program of Special Olympics Philippines. So, you can also, yung kasama namin na Pakistani dati, yung Pakistan na physical therapist, he was hired by Special Olympics Pakistan, SOP, to be the coordinator ng kanilang programs. So, pwede ka rin mag-work sa mga ganun. So, non-government organizations. Pero ang para sa akin, syempre, I'm a practice owner. So, the best para sa akin yun. So, I do my own treatment. So, if I want to have a full schedule, limbawa, umaga, dalawa sa hapon, or isa lang, di pwede. Depende sa'yo. And then you dictate your treatments based on your practice. Ganun. So, depende siguro kung saan nyo gustong mag-practice din as a physical therapist. Ayun, ano pa ba? Mayroon din nag-work as burn specialist, si Dr. Fronda. So, siya yung sa Wound Care Institute of the Philippines, I think. I attended one of his workshops in Manila. So, siya, physical therapist siya. So, he did his doctor physical therapy. And then, he specialized in wound care. So, ganun. So, a physical therapist who is working with clients who had burns. Ganun. So, after surgery, after debridement, so after medical treatment, they do physical therapy. So, sila din yung gumagawa ng wound care na din for infected wounds, mga ganun. Meron din nag-specialize sa lymphedema, yung mga lumalaki yung mga paa. So, I attended one course at FEU. Ganun din. So, nag-specialize siya. Physical therapist siya sa US, then nag-certify sa lymphedema management. Ganun. Yung lumalaki yung mga paa, nagmamanas. Ganun. Yung treatments nila. And then, my friend din ako na dito sa Pilipinas, meron din sa abroad, na private practice sila, pero they focus on home treatments. Yun yung pinaka, ngayon, bago ngayon. So, marami akong kilala ngayon dito sa Pilipinas who would prefer home visits, home physical therapy. So, you schedule your treatment with a client, tas bibisita ka sa bahay nila, and on certain schedules. Siyempre, kadalasan, if not all, siguro ng mga pasyente ko sa ngayon, would pay cash. So, cash basis tayo. Pero in the States, they do insurance. No, may mga insurance din dito na billing sa mga hospitals. Sa mga private clinics, you need at least 2 years before you qualify to apply for insurance billing. And then you need a medical doctor na accredited sa specific na insurance na yun, HMO, Health Maintenance Organization, no? HMO na magva-vouch or magbibigay ng kanyang prescription for physical therapy and then you do your thing. Ganun. Marami pang ibang mga ano. So, parang pahapyaw muna ngayon. We're just finished with our third question. Okay. Ito maganda. Can you describe what it's like on your first day as a physical therapist? Siguro nung pinakaunang ano ko, job ko in 1999, that was November of 1999, second semester. So, binigyan ako ng load ko to teach third year physical therapy students. No? And of course, our age difference is not that big kasi I just graduated in 1999 on that year. So parang very challenging to see myself as the one who is teaching instead of the one who is listening to the teacher. Ganon. And during that time, I also get to do my duties. No? Nag-volunteer ako sa Lorma Medical Center, and then I do my home treatments as well after work. So superman ako noon. That was 1999. So I do teaching full-time. I volunteer at the hospital on my vacant time if I have one, or I make one for my duties at the hospital. And then after duties, after work, I visit clients in their homes. Ganon. So, power. So, it's very exciting, no? So, depende sa ano kasi, I found out that individuals with who are extroverted, yung or who can easily adapt to different people, no? So, parang may certain self-motivation ka, no? Would do well with physical therapy. So, if you are not really open to learning about other people, parang gusto mo mag-isa ka lang, ganun. So, it would be very challenging for you to be a professional physical therapist. Yan. Tayo yung mag-adjust for our clients and not the other way around. So, I found my first day to be very exciting, very draining, pero very rewarding. Yan. So, I guess we need a positive outlook at the start of our professional lives. So I'm very excited for our first year physical therapy students at Lorma colleges and elsewhere. Push nyo lang. So with the challenges of the modular education nowadays on online education, mas malaki yung challenges sa inyo. Pero you know, we will get over this and you will learn a lot of things online. And then when you get back to Lorma and to your lives as normal students, no, with normal teaching and learning environment, mas madali kayong matututo kasi you have a lot of exposures online. There are a lot of resources online that you can maximize. So I hope you do that. Okay, next question. Did you encounter any difficulties in your career? If yes, can you share to us on how you adjust to certain situations? As a physical therapist, yes. Well, it started, I think all our professional experiences, no? How we adjust to our day-to-day lives as physical therapists on a professional level depend on our experiences as physical therapy interns. Yun. So parang on the 5th year of your education, when you do your trainings in various hospitals, doon mo makikita yung totoong trabaho talaga ng physical therapist. When you are still learning on your 1st to 4th year of physical therapy education, parang vague, no? So hindi malinaw ano bang ginagawa ng physical therapist, no? On your practices, you do range of motion exercises, you do shoulder elevation, extension, you do rotation, you do neck flexion, extension, sideward, ganyan. Pero hindi mo makita, you cannot get the totality of how you would interact with an actual patient. Ganon. So, in my internship, my first, siguro kaya ang gusto kong i-ano ko na lang is yung difficulty ko during my first month of clinical internship, which is at the St. Louis University Hospital of the Sacred Heart sa Baguio City. Imagine, May 1998 na nag-start kami, yung mga ibang schools, ibang interns started a month ago. So second month na nila, so nakapag-adjust na sila. So it's parang nakakabigla, no? In a way that you are afraid to make a mistake. So I guess that's the same thing with first-time professional PTs, no? Because you've just got your PRC license and you're afraid to make a mistake, especially when you use yung mga gadgets na pwedeng makasunog, no? Dati may shortwave diathermy, may microwave diathermy, mga ganon na mga gamit. Ngayon may shockwave therapy na, may laser, syempre yung very popular na ultrasound, mga ganon. And then the hot moist pack na pwedeng makasunog and then you can expose your patient to infection, ganon. So yun yung mga problema or yung mga challenges na on your first day you would always think na baka magkamali ako with my treatments with my clients. Ganun. Pero everything went well with the help of your supervisor, with your fellow professionals then. So kung intern ka, you have to work with your fellow interns, no? Another challenge would be meron at merong difficult clients, no? But we must understand that difficult clients probably are experiencing a lot of pain or a lot of frustrations. That's why they behave that way. So it's just an outlook, no? So when you go into your clinics later, when you treat a patient, so gas-gas na pero talagang kailangan, you have to put yourself in the shoes of the client. Ano ba yung nararamdaman niya? Bakit bugnutin siya dumarating? So bakit nakasimangot, binabati mo, hindi man lang sumagot, o ganon. So siguro, hindi nakatulog kasi may chronic pain siya. So he might be experiencing spine pain na hindi siya mapakali. Pag nahiga siya, masakit talaga. Pag tatagilid, masakit pa din. Pag uupo, hindi naman makatulog. Ganon. So, it's part of the job of a physical therapist to understand why a certain client behaves the way they do. Yun. So, it's a challenge, but it's not a problem. It's not easy, but it's doable. Pwede. Kayang-kaya natin yan. Okay, so yun yung tinatawag nila difficulties. I call it challenges that we can learn from. Okay. Okay, punta tayo sa specific conditions. Can you share to us some overview of the cases of patients you've previously treated? Number 1, stroke. Yun. So always expect that you will always have a stroke patient, no? Especially when you do hospital duties. So the number 1 na nangangailangan or those who seek physical therapy in the hospital setting and even home treatments and outpatient clinics ay stroke survivors. Yun pa rin ang number 1 natin. And for my practice now, neck and back pain patients, so spine patients, like those who have slip disc, may mga scoliosis, tabingi, letter C yung likod or letter S, idiopathic scoliosis, or mayroong yung age-related na spondylosis na tinatawag nila. You will learn all of these things while you go through the 4 years in your academic training and then on your 5th year for your internship. Overview. So kung stroke, expect na mostly half of the body is paralyzed. Sometimes even 1/4, no? Tabingi yung bibig, hindi makapagsalita, naglalaway, bugnutin, may behavioral problem din. Yung shoulder is lower on the affected side. Yung hand may be parang gulay, walang galaw, depende kung ilang buwan na siya na stroke or gaano ka-massive yung stroke niya. And then they cannot stand by themselves and they cannot walk. So imagine, as a physical therapist, you have, sa akin I always set 8 sessions kasi parang 2 times a week kung outpatient or home treatment. Pero kung inpatient sila, they do physical therapy every day. So every day na may duty kayo, you have to see them every day. So other clients, other doctors would recommend 2 times a day, my morning session and my afternoon session. So depende sa protocol ng hospital ninyo. Okay. What else? Bell's palsy, very common. So half of the face is paralyzed. So anong gagawin mo? So para tayong mga miracle workers as physical therapists. Those who have myofascial pain syndrome, yung matigas dito na nagre-refer ng pain na pagkakamalang migraines or shoulder pain or even parang mag-heart attack na sila. So yun pala, mayroon silang trigger points, no? Sa myofascial pain, yung cover ng muscle at yung muscle naninigas at nagsisend siya ng pain signals to different parts of the body. A very similar one is fibromyalgia. So more than 12 or 13 areas of the body, no, ay masakit. Maganon. So several painful areas. Or even other neurologic conditions like Parkinson's disease. So Parkinson yan. At may mga tremors sila. Parkinsonism. Meron ding clients who have weak bones or tuberculosis of the bones, no, Pott's disease. So madali silang manghina. So mayroon silang back pain kasi may bacterial infection yung buto nila. Or those who had fractures and dislocations, no, simple ankle sprain, no, patients who have iliotibial band, ITB problems, so sa mga sports conditions. So I had all those stuff. Meron din yung ALS, amyotrophic lateral sclerosis or Lou Gehrig's disease, yung sa bucket water challenge, yun. So ALS. Meron ding GBS, Guillain-Barré syndrome. So maraming conditions. Cerebral palsy, very common sa ating community-based rehabilitation. Mga bata na hindi develop yung brain nila. So either may motor underdevelopment sila, may problema sa sensory, may problema sa reflex, hindi makahiga ng maayos, naninigas yung dalawang kamay o apat, pati yung dalawang paa, hindi maidiretso yung neck, so they cannot sit up, they cannot stand up, they cannot walk. So anong gagawin mo as a physical therapist? And many more. Simpleng back pain, no? Simpleng neck pain, shoulder pain. So we do a lot of stuff to ease the pain of our clients and their despair and hopelessness. So yun yung nature ng job ng physical therapist. Of course, hindi lahat ng conditions can be treated. So hindi gamot yung physical therapy most of the time. Like halimbawa na stroke siya. So kung magte-therapy kayo, matitreat niya yung na-stroke sa brain niya? No. So we work hand in hand with medical doctors and other members of the rehabilitation team. So we work, everybody has their purpose, no? Para sa full rehabilitation, treatment and recovery ng pasyente. Okay. So yung goals natin as physical therapists is really to aid in movement. So dapat ma-achieve natin yung normal or near normal na movement ng pasyente. So nasabi ko yung example kanina, yung pasyente ko na she had stroke several months ago. May naunang physical therapist na nag-handle sa kanya. Pero I guess they focus on pain management, so they never achieve yung functional goal of walking. So on my second month, no, of handling her, nakakalakad na siya on her own with the use of a quad cane. And she's very thankful. She thought na hindi possible na makalakad siya. Pero the question is, did we heal the patient? On the brain level, the answer is meron. No? Movement therapy, meron siyang effect sa brain. So if a patient, a stroke survivor, sits around, sits, no, at nanonood lang ng TV the whole day, so ang nami-mirror sa recovery ng brain niya is good sitting. So na-perceive ng brain niya na the body is relaxed and watching TV. Yun lang yung natitrain nila. But when you have your stroke survivor practice to move, stand up and walk, so mami-mirror din, no, yung nung brain, yung activity na ginagawa niya. So yun. So Beavor's axiom, no, the brain knows not of individual muscle movements, only of gross movement. So na mirror, na re-record sa brain yung tamang pag-upo ng pasyente, hindi siya nakaslouch, hindi siya nahuhulog yung shoulder niya at ang layo na, nagsasubluxation na yung shoulder niya, hindi yung pagtayo niya na tabingi yung nare-record, kundi yung tamang pagtayo. Like, the affected limb tutulong para makapuwersa siya tumayo and then maglakad. Ganun. So, you will learn a lot of stuff, no, from anatomy, physiology, functioning of the human body, tapos yung abnormalities sa mga diseases and illnesses. So, may medical surgical conditions, orthopedics, pediatrics, ganyan, marami. Tapos, therapeutics, physical therapy applications. Okay, in your career as a physical therapist, what is the most difficult case that you have handled? Wow. Medyo marami, no? Difficult in the sense that parang walang nangyayari. Ganon. I guess isa sa mga challenges ko yung spinal cord injury. Like a total spinal cord injury. In the recovery ng brain compared sa spinal cord, mas mabilis pa rin yung recovery ng brain kaysa yung naputol na spinal cord. So remember Superman, Christopher Reeves. So meron siyang C1, C2. So at the level of C1, no? So ibig sabihin yung neck movements niya ay nawala na rin. Tapos yung breathing niya wala. So meron siyang respirator, meron siyang aid na nakalagay sa bibig niya para ituturo sa monitor, sa screen ng computer niya yung sasabihin niya. Ganon. So half and puff machine yata yun. Okay, so I guess one of the most difficult cases is spinal cord injury, where physical therapists actually can do our range of motion exercises, our strengthening up to the level na mayroong control yung spinal level niya. So kung broken na yung spinal cord at the level of the neck, expect problems sa upper extremity, sa galaw, sa paa, even voiding, pagtae, pag-ihi, no? So may magde-develop na yung mga problems ng maninigas and mawawala yung muscles niya, magma-muscle wasting, tapos yun. So parang however long the treatment may be, ilang taon na siya nag-physical therapy, yung functional level niya is limited by the condition of the spinal cord injury. Ganun. So ongoing pa lang yung research with spinal cord injury patients. Another one is Parkinson's plus syndrome. So this is different from the Parkinson's disease. Wala pa ring gamot. So may amantadine sulfate tayo, pero limited yung absorption sa brain. So the tremors still come, no? When the patient is awake, tuloy-tuloy yung tremors niya, naninigas yung kamay niya. So even if you do physical therapy, lalaban pa siya. Kung pupwersahin mo, pwedeng mapunit yung muscles. Another one is GBS. I had a patient na Guillain-Barré syndrome. Magka-college na sana siya, pero biglang nagkaroon siya ng total collapse ng respiration niya, nawala yung hinga niya. So na-ICU siya for 1 month. Tapos with treatments, with medication, na-recover niya yung strength ng upper extremities niya. Pero after that, mahirap i-recover yung lower extremities niya. Mostly neurologic cases are very challenging. I guess that's why I'm going into musculoskeletal practice. So mga back pains, ganun. 1 session, okay na. Tapos kung mali na naman yung pagbuhat nila, nag-click yung likod, balik ulit sa'yo, i-adjust mo yung likod nila, you do strengthening of the core muscles, good to go ulit. So mga ganun. So you will find out which track you would go into. Pero sa Pilipinas, we do general physical therapy. So I'm a general PT. I do neuro physical therapy, neurophysio. I do musculoskeletal. I do pedia. I do wellness. No, I do sports rehab. So may mga patients ako who are basketball players, runners, marathon runners, yung mga nag ultra marathon, mga 21 kilometers, mga ganun na overnight run, obstacle courses, so we can do that, no? Okay, next question is, how do you set expectations and provide status updates to patients and their family members? Very good question. So, ito yung na-overlook kadalasan, no? Like, a patient comes in for your services, Pero you seldom talk to the members of the family and ask ano yung perception nila sa condition ng ano nila, ng family member nila. So they think that with one session, pwede na. No. So you must understand, yourself as a PT must understand the disease entity, kung neurologic case, kung musculoskeletal siya, what's causing the weakness, what's causing the numbness, what's causing the lack of balance and coordination, ganun. So kailangan magkaroon ka ng patient education doon pa lang sa first session. That's why on the first session, mostly initial evaluation. Very seldom that we do treatments on the first session. So initial evaluation could take 30 minutes to 45 minutes depende kung anong case ng pasyente. And you would charge for one session already for initial evaluation. So during that time, after your assessment, you get to ask the patient or the client himself and the family, what are their expectations? Para during each and every session, you have to measure what is happening during that session and check it with their expectation. Na-achieve ba natin yung goals ninyo? If not, what's wrong? Most of the time, ang problema, the client or the patient is working with the physical therapist during the session. Nag-iwan ka ng home instruction and then you teach the family member the home exercise program. When you come back, you have to follow up. Ginawa ba nila? So nobody would answer yes. So mostly hindi ginawa. The patient would say, oh, nakalimutan ko. Okay. So you have to go back to the expectations sa una. So may expectations ka as a physical therapist from the patient and the family members. May expectation din sila sa'yo. So it worked both ways. So we are not here to prove that physical therapy works. No. We are here to assist the client recover. Ganon. So may mga conditions na ang iniisip ng pasyente, physical therapy would treat the condition. Okay? So not all the time na ganon. Halimbawa stroke, dahil nag-physical therapy siya, may babalik na yung control sa brain. It's not as easy as that. So you have to understand neurophysiologic processes, paano nagre-recover yung na-stroke na brain. So kung nag-close yung ugat, if a blood vessel is closed on that area, namamatay, the part of that brain dies, and the part of the body controlled by that brain part would cease to function. So, rewiring ng brain. So the brain is very intelligent. With movement and with physical therapy, the brain would look at other synapses, connections sa brain system para maibalik yung galaw doon sa affected na limb. Galaw, sensation, reflexes, all of that stuff, and function. Ganon. So yung question na yun, how do you set expectations and provide status updates? On the first day, very critical. You need to set expectations. So kung spinal cord injury yan at the level of the neck, cervical, tapos sasabihin mo, total yun sasabihin mo, oh, in 8 sessions we will walk. No, hindi kayo miracle worker. So, but you have to be realistic with your functional goal setting. So ibig sabihin, you have, as a physical therapist, you have an understanding of the disease entity. You have an understanding of neurologic recovery. So yung nerve na naputol, magre-recover ba? Yung spinal cord na naputol, babalik ba? Yung brain na affected, na nawala yung control, magre-recover ba? Ganon. Or kung sa orthopedics, like na fracture, how many weeks bago mag-fuse yung bone? So kailangan na bang ipabigat doon sa affected limb o 50% lang ba? 20%? Of course, you have to work with a orthopedic doctor. No? Yung surgeon ang magbibigay sa inyo ng clearance na go for 50%, go for 75%, works like that. Pero in the States, they have their protocol that they follow. So they do not wait for the doctor to tell you what to do. Because the doctor, iba yung work niya, iba yung work ng physical therapist. Okay. Ayun, maraming mga ano dun, how we go through that process of setting expectations and, you know, but you have to be objective. Kailangan ma-measure mo. So, your goals should be smart, no? Specific, manageable, attainable, realistic, and time-bound. So sinasabi ko, okay, in 8 sessions, you will be able to stand up on your own and do balance, so shifting from left to right. After another 8 sessions, you will be able to walk on your own for 10 meters, no, with the use of a quad cane. Ganun. After 8 sessions, tapos na. So, okay na tayo for the lower extremities. Then, I would refer you to an occupational therapist for hand function rehab. Ganun. So, that's how I do my... And you only learn to do that when you have handled several clients already. So, do not expect na on your first day on the job, you will be very proficient on how to set expectations with your clients. So, you have to make mistakes early on during your professional or even on your internship kasi may supervisor ka pa. When you are a student, when you are learning, it is okay to make mistakes. Basta walang in danger, no? So, basta honest mistake, it's okay. But if you keep on repeating those mistakes, it means that you're not learning. So you have to learn from certain mistakes so that when you become a professional and nobody is there to supervise you, you are answerable to all your mistakes. Baka mawalan ka ng lisensya or baka makulong ka pa or baka makapatay ka ng tao. So remember, we are working with human beings. So hindi mga bagay o hayop yung mga tao na pinapasyente natin. And they pay you. They give you an energy exchange in the form of monetary payment, no, bayad. And you are expected to perform professionally. They expect you to know what you are doing. Ganon. That's why the title of a physical therapist is very official. So you need to pass the board exam for physical therapists to be able to say na, oh, I'm a physical therapist. So yung mga gumagamit dyan sa labas na nagmamassage, no? So I guess that's the next question. So you can actually report that to the Board of Professional, to the PRC, no? May ano din sa Physical Therapy, Philippine Physical Therapy Association. So I hope we will have our own parang ano din, arm talaga, an arm in La Union, in Pangasinan, elsewhere, to police those who are claiming to be physical therapists, but in actuality, they're not. So, it's against the law. So, it's under Republic Act 5680. So, dapat, pasado ka ng board exam before you can say that you are a physical therapist. Okay. What's the next question? Do you still observe or had experienced prejudices? Wow. Mapiprejudge tayo. Prejudices or misconceptions, yung hindi pagkaunawa with regards to our profession. Yes, no? So, most of the time, they think that physical therapists do massage therapy. So, mga manghihilot, ganun. So, take note that with Physical Therapy 1 subject, your PT1, an Introduction to Physical Therapy, the word massage is there. So, ituturo kayo ng basics ng massage, but it's just a technique. So, hindi tayo masahista, no? We are physical therapists. We do holistic assessment of the patient. So, may proseso siya. You do initial evaluation, you do goal setting, you plan your management, and then you progress your patient until they can discontinue your services. So it's a healthcare profession. We do not, parang hindi natin minamaliit yung trabaho ng manghihilot o ng masahista. We're just saying that we are not massage therapists. We offer more than massage. We offer achieving functional goals and achieving the a level of productivity of a client after an accident, a disease, an illness, or whatever condition that affects their human movement. So physical therapists are movement specialists. Okay. So how do you go through with that? So if they ask you if you do that, you would say, no, I'm a physical therapist. So here's what I can do. Okay. And most of the time, patient education is a big deal. No? Even clients who undergone services with my clinics, they're the ones who share what services we offer. So do not be too defensive if they call you masahista, if they call you massage therapist. It's a very good opportunity to educate them what physical therapy is all about. So dapat may elevator pitch kayo in if they ask you, oh, what does a physical therapy do? So in three minutes tops, no, you can say that physical therapists are movement specialists. We assess patients on how they move and how they do their activities. Um, we help them get back on their feet after accidents, after diseases or illnesses. We help them recover and achieve their normal or near normal productivity levels. So mga ganon, you can do a practice later, no? So how to educate other people on simpler terms, no? Okay. So can you give us some tips when starting in the field of physical therapy? Okay. In your first probably 5 to 10 years, no, do not be too choosy, no? Wag kayong all you need to do is to get a job, no? So after you get your physical therapy license, within a month, no, siguro within the first 2 weeks, you need to get working, either as a home PT, because you have a license already, so you have to register with your local government unit. You have to get your mayor's permit, no, you have to be legit, no. So most of my friends do not have registration with the local government unit and with the BIR, no. You have to get your papers in order para kung whatever happens, you can also issue your official receipt, no. You can pay your taxes through your PTR sa munisipyo, kanyan. So I guess the tip is to get working when you get your license, PT license, when you're already a professional. So realize your work as a PT, either through direct home PT or pwede if you can apply in a hospital. Whatever job you may get na related sa physical therapy is great. Okay. And then, after 5 years, so ang unang trabaho ko ay faculty. So 1999 to 2002. And then I went to full-time mission for my church until 2004. I came back to teaching 2004, 1 year until 2005. And in 2006, I applied sa hospital 2012. Hanggang 2012 ako doon. So 6 years. So totality 1999 to 2001, 2000, 2001, 2002, 2004 and 5. Tapos 6 years. So 10 years. So I was an employee for 10 years before I resigned and put up my own practice. So ganon. So it's not easy to put up your own practice as a fresh graduate. You need to learn the ropes. You need to learn how big hospitals function. So as a professional, you need to see how, home care, home health physical therapy works in your area. So who would refer patients to you? Kasi we don't have direct access pa din sa Pilipinas. As a physical therapist, you need a medical doctor with the old law, RA 5680, to refer patients to you. So whoever the physician, basta medical doctor na magre-refer sa inyo. Okay. So I guess that's my tip starting in the field of PT. Do not be afraid to work your butt off. So get up and working. Work. So lalo na bata pa naman, no? After graduation and after your licensure, you are still very active. So remember, I started as a faculty member, and on my free time I volunteer at the hospital, and then I do my home treatments after duties. Ganun. So the more hours you put into your physical therapy practice, sabi nila, to master something, you need at least 10,000 hours of direct practice. So I think 10 years is more than 10,000 hours of actual physical therapy practice. And then you do your own thing. So if you want to put up your physical therapy practice, but most PTs go abroad in the US or elsewhere, no? So depende sa gusto ninyong gawin. Okay. What are the most important qualities that a physical therapist should have? Yun. So number 1, I think, is you are not too self-absorbed. Hindi kayo nakatutok lang sa sarili ninyo. I guess that's the number quality of a physical therapist. Um, Not egocentric, yung mayabang na yung kakayanan mo lang yung pinapangalandakan mo. So that's not good. As a physical therapist, the number one quality should be to shift your focus out away from yourself towards somebody else as a client. Ayan. Or yun, you practice now, no? As a physical therapy student sa first year, try to observe people around you. So, sa family pa lang, how they sit, how they move, how they walk. Oh, bakit may limp siya? Bakit mali yung lakad niya? Bakit masakit yung ulo niya? Bakit ganun siya umupo, no? Bakit lagi na lang na pag may pupulutin sa baba, totally yuko, hindi siya nagbe-bend sa hip and knees niya? Bakit yung lola ko, very short yung steps niya, tas laging natutumba, laging sumasakit yung tagiliran niya? Okay, stuff like that. The qualities of a physical therapy ay kailangan na you have to focus on other people. So you have to use all your skills to help somebody. So it's not about us, it's about the client. Yun ang tutok ng physical therapist. So in my treatments for 1 hour, I focus on one client. So I do not multitask. So multitasking is really dangerous kasi if you have put an electrotherapeutic modality sa pasyente, kinukuryente mo, tapos iniwan mo, pumunta ka sa kabila, no? That is a potential risk, no? An accident waiting to happen. Yan. So you have to focus everything on another person during the whole session. Ayun. So what else? Ano ba nakalagay? Qualities? Yeah, important qualities. Ayan. Okay, so we must be healthy, I guess. Focus on health and wellness ourselves. So if you are sick, if you as a physical therapist have back pain and you cannot treat it, that's the irony, no? Most of the physical therapists I know, even myself, have back pain. So my shoulder pain, my back pain, okay? So we need to manage our symptoms ourselves, no, with the help of our fellow physical therapists as well, or with proper body positioning and proper body mechanics. Ayan. So if we cannot take care of ourselves, how can we take care of others? I guess that's one of the qualities of physical therapists. Ano pa ba? A good communicator. So we need to learn how to ask questions. So history taking, no? So physical therapy 1 is part yun, history taking. You need to learn, you need to know how to adjust to the level. Kung bata yung pasyente mo, pediatric patient like 6 years old, 7 years old, how would you ask questions? No? How would you relate to them? Kung matanda naman, 90 years old na yung pasyente, or kung foreigner yung pasyente, meron ba tayong cultural competency? So can we shift from our Filipino culture to an American culture to truly understand what they are coming from? Ganon. Baka yung perception nila ng pain is different from our perception. Ganon. So we have to communicate very well, not really with the language, but it's part of it. So it's how we use words and how we use the tone of voice that we have. Even our body gestures, no, our body movements can convey certain meanings, no. So if a client comes in and then nakayuko ka lang and then you don't do eye contact, what does that mean? So so you're not open to a client or another person. Parang okay, pasok po kayo, diretso po tayo dito, we'll do your treatment. Okay, thank you sir, see you next time. So parang robot, no? So a quality, one of the best qualities of clients is that they know how to they know how to put they know how to get into the shoes, or empathy, no? They know how to empathize. Parang you try to understand what the patient is going through. Most of the time that seems impossible kasi hindi ka naman na stroke, no? So to really know what a stroke survivor experiences is to be a stroke survivor. Pero as a physical therapist, because we are learning these things during class and during our actual client interactions, kailangan maintindihan natin na yung client is having a very difficult time. And yung expectations natin from a client, a stroke survivor or whatever condition they may have, should be realistic. You know? So wag kayong mainis kung hindi maitaas ng pasyente yung shoulder niya to full range, no? Hanggang dito lang masakit na po talaga, or kahit ilang beses mo siyang ipagalaw sa shoulder lang, wala talaga, zero pa din. Okay? I would say patience, pero that can be learned. No? So you can learn patience. I had one classmate dati na ano siya, mayaman sila. They are from a very rich family, very influential family, no? A political family. Pagpasok niya, she's a lady. No? Pag kumakain siya, tapos yung gulay, kakainin niya. So, slice niya yung gulay, green peas, ganun. Open niya, alisin niya yung buto, isa-isa, tutusukin niya yung half nung green peas, tapos isusubo, ngunguyain niya ng siguro 5 minutes bago lunukin. So, the point is, parang napaka-ano siya, napaka-social, ganun. Pero, nung nag-duty siya, comes internship, na-assign siya sa community-based rehab, mga cerebral palsy patients. Nakita ko na lang siya na nakakalong-kalong ng pasyente na naglalaway, tapos they're trying to have the client, no, sit up straight, pero hindi kaya. So, puro laway na siya. So, ganun. So, patience can be learned as we go through our internship and as we go through our professional lives as physical therapists. You never expect to treat somebody with a certain condition, no? And yung expectations natin would be very different when we are in that condition, situation already. Ganun. At marami pang iba. Maparaan din yung physical therapist, no? So, kailangan alam mo yung, kung limited ang resources ng center ninyo, not necessarily you use your own money, so how can you improvise materials for therapy? Pwede din yun. Okay. What else? I guess ambitious pa yung isa. I have a, dati estudyante ko siya, tapos naging colleague ko siya sa rehab. He is very ambitious, no? Ambitious siya. Hindi siya, he is not easily, parang hindi ka nakukontento. He's not easily contented with the situation, no? He always needs to push forward, no? Move forward. And now he is a doctor of physical therapy himself, no? So, ganun. So, if we need to do something and we want to achieve something, we need to work for it. So, we need to be ambitious, resourceful, and we learn patience, and then we focus on others instead of being egocentric, na masyadong mayabang, no? Alam mo na magaling ka, wag mo nang ipangalandakan. So, gamitin mo yung galing mo and yung skills mo to help somebody else to achieve their functional goals. I guess that's the most simplistic way of telling somebody to shut up and do your job as a physical therapist. Okay. Patapos na tayo. I think we have last 3 questions. 4. What are the differences of the physical therapy profession in the Philippines and in the US? Wala pong pagkakaiba. So it's the same, it's one and the same thing. Our license as physical therapists, our education in the Philippines is an exact copy of the curriculum of the American Physical Therapy Education. So lahat ng mga ginagawa ng mga puti, ng mga Amerikano as physical therapists, ginagawa din natin and more. Do you know that our professional units are 90 plus? Ang required lang sa kanila is just a fraction of the 90 units. And our internship, our 1 year, our 10 months clinical internship ay sobra-sobra sa kanilang, I think 3 months or 4 months lang yung clinical internship nila. And our board exam na 600 points, sa kanila 200 points lang yung board exam nila. So, sinobrahan, kinopya na natin, sinobrahan pa natin. Okay. So, there are so many physical therapists, Filipino PTs who go abroad and they make it big because our training is really geared for the American healthcare system. Okay, that's why in recent years, they introduced the community-based rehabilitation. Wala sa US yon. So, they do not do community-based rehab. Kasi they have a very, first world countries have tertiary hospitals all around the area. Sa Pilipinas, if you go to the barrios and the barangays and you don't have a hospital, you have to put up a community-based rehabilitation program with your local government unit. Ganun. So ano yung pagkakaiba then? I guess it's the culture. Physical therapists in the Philippines, no, are seen as not really healthcare professionals but as massage therapists, and they are lower than other professions sa Pilipinas. But when you go to the US, you are a doctor of physical therapy. So you are a specialist. So you're working, and nobody would dare to, dictate what you should do because you are a doctor on your own. So physical therapy is a doctoring profession in the United States. In the Philippines, bachelor's degree, but we have an offer from the University of Montana in cooperation with Far Eastern University. That's the TDPT, the Transitional Doctorate in Physical Therapy. So you need to be a physical therapist registered in the Philippines and working in the Philippines to get a big discount when you enroll on the modular online course, Doctor of Physical Therapy with the University of Montana. In the coming years, we will see, kasi nakapattern nga tayo sa US. So pagsasabi ng US, physical therapy is a doctoring profession. In the coming years, we will also see the trend that we already have actually mga 5. We have the first 5 batches of Doctor of Physical Therapy who graduated from the University of Montana, who are based in the Philippines. Pero marami na din from Lorma colleges like Ma'am Arlene de Vera Cabanban, DPT, Joey Hermosura, DPT, Elmer, nakalimutan ko na si Elmer, ang palyudo niya. And all of them are doctors of physical therapy, and they are making it very big in the US and elsewhere. Yeah. So yun din, I'm an aspiring doctor of physical therapy. I hope ma-renew ko yung TOEFL IBT to enroll in the course, and that will start in January. So I need to get all my credentials in by December and to get that $200 discount per unit. So sa kanila, it's $450 per unit, and the whole course is 30 units. And you will finish your Doctor of Physical Therapy in 2 years and 4 months. So tri-semester sila. Ganon. Okay, so I guess I've answered that. Differences of physical therapy. And then, in the US, maraming opportunities to specialize. So if you are into, manipulative physical therapy, so spine, and then you have the board, no? For example, you are focused on geriatrics, so you can get your geriatric clinical specialization, GCS, after your registration as a PT in the US. Or you can get your NCS, neurologic clinical specialist, or OCS, orthopedic clinical specialist, mga ganon. Yun ang difference ng practice natin. Sa Pilipinas, mostly, general physical therapy yung ginagawa natin. Okay, third to the last question, can you give us some basic ideas on how therapy sessions are formulated? Okay. I mean, probably the physical therapy management. The question is, how do you plan your physical therapy management? Okay. You have a POMR, yun ang pinakagamit, a problem-oriented medical record. So when the patient comes in, so sa subjective, so the client would tell you ano yung nararamdaman niya, what is your chief complaint, ano yung pinaka-problema mo. So masakit yung paa ko pag naglalakad. So ino-note mo yon. And then, you note how the patient is walking, may postural deviation, tabingi yung likod, and stuff like that. May limp siya, ganyan. Naka-crutches siya ba siya, naka-cane siya, or what, or naka-wheelchair, or binubuhat siya, pumasok, naka-stretcher. Okay, and then comes objective, you check for vital signs, so blood pressure, pulse rate, respiration, temperature, and stuff like pain levels, ganyan. Subjective yon. So objective, vital signs. And then you do your special tests, kung orthopedic case yan, or kung neurologic, you do your sensory testing, motor, or strength testing, joint range of motion testing, and feel, stuff like that. neurologic tests and stuff like that. So, manonote mo lahat yung problema ng pasyente. So, that's for the subjective and the objective. And then comes your assessment part. You will note your physical therapy diagnosis. What do you think is the condition all about? It's different from medical diagnosis. Halimbawa, ang sinabi ng doctor, post-CVD, cerebrovascular, post-CVA, left, kanon, with right hemiplegia. Ganon. So, inonote mo naman yung asan yung weakness. So, in your PT diagnosis or impression, you would say weakness on right side of the body, no? And then you would enumerate all the problems na noted, no? So, weakness on group of muscles na ganito with grade of 3/5, 0/5, range of motion, major joints within normal limits, except ano yung limited yung galaw niya. Yan. And then, based on the assessment part, yung problem list niya, you would then make your plan, yung management. So, would you use electrotherapeutic modalities? Magkukuryente ba kayo? Mag-ultrasound ba? Mag-infrared? Mag-hot moist pack? Superficial or deep heating? What therapeutic exercise would you do? Would you do passive? Would you do active assistive, active, progressive resistive? Ganon. Would you do stretching? Would you do functional training? Stuff like that. And then your home instruction and home exercise program. And then how many sessions do you recommend? And how many total sessions and how many sessions a week do you recommend? Ganon. So, after that, you can also coordinate with your supervisor, or kung sa hospital basis, hospital setting ka, or you ask a colleague, and then you discuss, of course, within the hospital environment, no? Please take note, for professional practice, you do not discuss cases outside of the work environment. So, it's a no-no. So, sa Pilipinas, parang nasanay tayo na nagkukwentuhan tungkol sa cases ng pasyente. Pero in professional practice and ethics for physical therapy, we do not discuss details of patients' cases outside of the work environment. Sa loob lang natin pag-uusapan yun. Kundi mapafile kayo ng malpractice. Pero sa Pilipinas, wala pa akong nakita na nasampahan ng malpractice. Or yung confidentiality sa medical record. Sa US, marami. I guess that's one of the difference again. Sa US, may malpractice suit. So, may malpractice insurance. At mayroong yumayaman na mga tao dahil nagsasampa sila ng mga professional because of malpractice and unethical practice. Ganun, confidentiality ng medical records. Okay, so how would you know that you have the right plan or physical therapy management? When you do it and you check for progression, lumakas ba yung pasyente? Did you achieve your goals? No? So again, SMART goals. So sa assessment part, may nakalagay doon na short-term goals, long-term goals. So very specific ka. Attainable ba yun? Would that be achieved in, manageable? Magagawa ba yun? Realistic ba? Parang palalakarin mo yung pasyente na may spinal cord injury in 3 sessions? I guess not. Time bound. So maglagay ka ng oras. When the goal will be achieved. Ganun. Okay. So that's how you go through formulating your physical therapy sessions or physical therapy management. Okay, as a physical therapist, what is the most important thing to you? Wow. Depende eh. So, this is very subjective, but professionally speaking, it's really the progress of my clients. So when your patients are progressing, when you relieve somebody else's pain, when you have a patient who cannot walk finally stand up and walk on her own, I guess that's the most important thing for a physical therapist, is to be able to help someone achieve their functional goals. Yun ang pinakasimple, I guess, as a physical therapist. Secondary na lang yung when doing your job, you get your monetary, parang yung energy exchange, no, mababayaran ka for your services, automatic yun, no? Because if you cannot do your job, you will not get paid. Um, ano pa? Popularity, ganun ba? Sa Facebook page, we also only use that for marketing so other people would know that we provide these services. So I guess it's not, parang secondary na yon. So it's a byproduct, no? So money, popularity, sense of fulfillment, parang byproducts na lang yun of the things that you can do for another person being a physical therapist. What makes you happy in being a physical therapist? I guess it's the same question. Right now, I'm a very independent practitioner. So when a client comes in with a referral, we work with the client until they achieve their goal, and then we give a progress report to the referring doctor. So babalik siya sa doctor niya, sasabihin niya, oh, I did physical therapy with Noel and we achieved my goals. Or if it's not working, I would be realistic with the client and would say, oh, I guess it's not working. We can do another program, or we can try this one, and then we'll reevaluate. Ganun. Or if it's not really working, by pain pa din siya despite everything, no? So spine pain, we had a patient before na chronic, years na yung pain niya. And he keeps on coming to the hospital for physical therapy. After a session, may relief of pain siya. So walang sakit. Pero after a few days, masakit ulit. Later on, we found out, no, nalaman din niya na may cancer siya. So red flag, no? May mga red flags, yellow flags in our practice. Chronic pain na longer than it should be is an indication of a very severe condition. Ganon. So what makes me happy now as a physical therapist is that I can do my own thing. I have my own clinic. I work with indigent families in the community-based rehab. I work with children as well. I do home treatments. I do, kung may walk-in, I can easily talk to them and discuss their condition as much as I can. I'm not a medical doctor. I'm a physical therapist. I would tell them that. Yun. So, wag nating agawan yung trabaho ng doctor, no? So, that the job of a doctor is to do medical diagnosis and provide medical treatment and then refer to us for physical therapy. So, our jobs is to do evaluation and assessment. We plan the program with the patient. We achieve goals and then we discontinue or we discharge them from our services. Ganon. Okay. I guess I've covered every question now. Let's see kung may na-miss tayo. Okay. So for the remaining minutes, I would also want to read some other feedback from our clients. No? So this, yung binasa ko kanina from Ma'am Heidi Apiado. So again, the link is on facebook.com /noeloribio.physio and then go to reviews. Na-type ko yata kanina. So let me type it again. So you can check it out later. Yan. So if you want to check how our clients are doing and their feedback, no, you might want to check that link. Hello, thank you Ma'am Christy. Thank you for coming. Ayan. So sana may matutunan po sila sa ating live stream ngayong gabi so you can share it with your whole class. Thank you po and tell them to watch the ads para sa ekonomiya. Thank you very much. Ayun. So sabi niya si Rain, no? Taga Australia siya but she came home for a vacation. Sabi niya the best therapist. Wow, highly recommended. Thanks hips for professionally treating my shoulder and neck pain. Totally worth the travel. So taga Pangasinan siya and then she came to La Union for a treatment before she went back to Australia. Ayun. Sabi naman ni CJ Glenn, so taga London naman siya sa UK, so he is a nurse there. I have been suffering from shoulder pains for quite a while. This problem was sorted when I visited Noel's clinic for treatment. I immediately, because I also do acupuncture besides physical therapy, I immediately felt relieved after a single session. Noel is very professional in his approach. His clinic is conveniently situated. Nasa Pennsylvania pa dati yung clinic. And it is very accessible. Many thanks, Sir Noel. Ayun. Ayun. Sabi naman ni Sir King D, Mr. Noel is one of a kind in his field of expertise. He caters his patients, not just a patient, but with genuine care. Wow. I am recommending him to anybody who needs help for recovery. And sabi ni Ma'am Melissa Ann Brimhall Smith, sila yung sa doTERRA essential oils. Noel is very progressive, always learning and looking for the newest treatments. Yan. Sabi naman ni Madam Eloisa Alvaro Rivera, the most accommodating physical therapist I know. Thank you, Sir Noel, for helping my husband to recover. Ayun, so seaman yung asawa niya na nadisgrasya. So, nakalakad na din siya and back to work dati na. And si Ma'am Lucrecia Islao, nagpapasalamat ako kasi na-meet ko si, they call me Doc but I'm not yet a doctor. Si Doc Noel, a physical therapist. Marami akong nararamdaman sa aking katawan, lalo na yung laging pananakit ng ulo ko araw-araw at masakit lagi ang likod ko. Salamat at nawala na rin sa tulong ni Noel Oribio. PT, magaling at hulog siya ng langit para sa akin. Thank you sa nagrekomenda sa akin na big salute from me. Alam mo na yon kung sino ka, sabi niya. Ayun. So, just check out the link for our feedback. So thank you very much po for coming to our live stream tonight. I hope na we can spread the word around about physical therapy in La Union, Pangasinan, and throughout the Philippines. So we can, marami tayong magagawa to help our fellow individuals, mga kasamahan na who are experiencing pain and who have difficulties because of disease, illness, and accidents. So all we can do is to give a helping hand and then share our practice as professional physical therapists. To all our physical therapy students, continue in your study of physical therapy. I did mine until I graduated in 1999 and I'm still learning now. Now is 2020. So tuloy lang tayo. I hope to finish my Doctor of Physical Therapy in hopefully not as long as, parang hindi na haba in 3 years time, pero we need to work for it. And I hope to meet every one of you when I visit Lorma colleges. So thank you very much for the questions, Lois, Rhaycy, Cyd, and Odella, or Odelia, whatever you prefer. And Ma'am Christy, thank you po. And to all our viewers, please click on the subscribe button and the notification bell. Watch and like our videos and leave your comments below para mabalikan ko po kayong lahat. Thank you and have a blessed night po. Ayun, so nawala ako. Bye-bye.